Yeah, we'll double back onto that conversation, but suffice it to say, everything ranging from patient security to artificial intelligence to assistance with practical applications such as telehealth and all of that, electronic medical records, for example, all of that is not only coming, but it's here. And the real challenge moving forward is how it will be part of the ongoing evolution of healthcare delivery. So stay tuned. What I'd like to do at this point, and I'm going to actually ask the senator to start thinking about this as I tee him up, but there is a need for a specific type of conversation in the state. I mentioned earlier how healthcare outcomes nationally were quite low. Well, in the state of Illinois, they actually are not quite where they should be anyway. Different surveys have ranked the state of Illinois' performance somewhere in the mid 30s to the upper 40s in terms of production of healthcare outcomes, which is not the type of return on investment that you would expect for a $19 billion spend. So therefore, it begs the question, what are other entities doing that are producing better healthcare outcomes? It actually is such a level of performance that it actually begs for a reimagining, well, you can potentially say an enhancing of the system perhaps, or even a complete reimagining of service delivery. And I want to go back to the initial premise, and that is where you look at specific entities and areas in the state where there are healthcare disparities and especially poor production of healthcare outcomes. I would tell you that if you're looking for return on investment, human capital is every bit as important as financial capital. And the underutilization of communities of color in service delivery is something that easily explains the situation that we find ourselves in. And with that, I'd like to transition into a very brief description of SIMCO. SIMCO itself is fashioning itself as America's first managed preventive care organization. We actually aim to be parallel to the practice of medicine. What we aim to do is to put what are known as best practices in public health, health prevention, and health promotion, and to deliver those to patients all under one roof in the same way that clinics and managed care organizations aim to provide curative care, also known as sick care, to patients. So we are the mirror of what happens once you get sick. Now, in our efforts and where this is relevant toward this audience in this conversation, is that we aspire to do so with a group of businesses and organizations that are entirely reflective of the makeup of the citizens of the state of Illinois. We actually can go into rural areas and provide culturally sensitive and culturally specific care in those communities because on one level, SIMCO is a big general contractor. We actually have already, even before we get approval from the state for the project that we're proposing, we have already enlisted over 100 different vendors who will implement culturally sensitive and culturally specific services with health prevention and health promotion in mind in different parts of the state. And you don't have to be a healthcare services provider to qualify, obviously. We've had Marlo talk about the need for financial considerations. That means there's going to be a ton of accounting vendors, for example. Arnold has talked about all types of things, and there will be needs for IT vendors. You know, again and again and again, we are reimagining how service is delivered, and we are focusing on opportunities and not obstacles. So what we are looking to do is to not only serve as a way to bring businesses together and engage in cooperative and collaborative economics, but we also are looking to serve as a think tank where the collection of data, as Arnold mentioned, is an ongoing process. We want to be data-driven and we want to be outcomes-based. It is of interest to me how people tend to skirt accountability. We actually welcome it because we will always be driven by what, just in the true nature of a scientist, we will always be driven by what the data tells us works best. And to that end, we want to continuously use an IT apparatus to point us to community-specific solutions inside of a state-specific solution. And so there's so much to this. And that's where we're going with this. We want to have this state demonstrate a level of leadership in health prevention and health promotion. And we think that that will distinguish it, position it very well for the future, and really embrace what's happening on the federal level in terms of healthcare innovation and value-based care. So when you hear something like healthcare transformation, I actually welcome, because I'm always a both and type of person instead of an either or. However, you really can have healthcare transformation without building an infrastructure that at the root of it has health prevention and health promotion as the first two blocks that you're building. So the Simcoe solution really is to engage people before they get sick, to transform you to being into better stewards of your own health, and to enjoy the benefits of a better quality and a longer duration of your life. So with that being said, I am actually hopeful. Do we have any of our other, we have a couple of other panelists that we want to introduce you to. And as they join, I'm going to be introducing you to three of the anticipated subcontractors who represent different industries that show you just how the Simcoe solution actually can not only provide better healthcare outcomes in the state of Illinois, but can actually provide opportunities for minority businesses such that we can grow, we can become bigger, better, and actually do things in a way that hasn't traditionally been done, and will increase the number of businesses that graduate from being subcontractors into actual primes. I really think that until they get on the phone, this is a good time to Senator Kaler and just let you opine on what you've heard, thoughts that you have in general on the state of healthcare, and what you would like to see, and expand on what you've heard. And then as we wait for our other panelists to join us, I'll start looking at the questions that you've offered. I see that there have been hundreds of comments. We'll see what questions actually exist there, and perhaps while we're waiting, we'll address some of those. But let me turn back over to Senator Kaler.
Yeah, thank you, Dr. Sterling. I think this has been a very honest and very forthright conversation. Let me first of all say something to Dr. Lubin Johnson. I knew more than 15 years ago when we sat together on the Adequate Healthcare Task Force that you were somebody that I needed to pay attention to because you knew what you were talking about, and that's true then. It's true today. And the reason that I think that you offer such an insight into this whole area of healthcare and how do we really make it work in our communities is that not only are you an excellent doctor, but you understand context. You understand the context of the cultural, political, and economic realities that people face every day. And I think that's important because we have to really define this from the point of view of the patient. What are they seeing? What are they experiencing? And how does this affect them? First of all, Dr. Sterling, I would say that I think we have to agree that the problem with healthcare in Illinois or anywhere in the United States is not that we have a lack of money. We're talking about almost a third of the state's budget. There's plenty of money in the system if we understand a more effective way to use it and to get the results that we need. And you and I have talked a lot about the Simcoe approach, and I absolutely am a believer in that, that if we really spend our time in talking about health and about how we tap into where people are living at right now, and how, I mean, everybody desires to be healthy and to be healthier. And let me just give you an example. And I think that outcomes in healthcare, see, this is the whole premise of why Obamacare was established. The Affordable Care Act was to say that we want to look at quality-based outcomes. And I'm a firm believer that the better quality you have in healthcare, the cheaper the cost, because there's efficiencies in that. So the better quality of healthcare, the better the costs are in terms of providing that service. I'll just give you an example of what it means to really be quality focused on the outcome. There's a local physician here in Peoria who tells the story of having a patient that was a frequent flyer to the emergency room. And this woman came in constantly with respiratory problems, asthma attacks, and they would treat her time and time again, send her home, and she'd be right back. And finally, they figured out how to treat this woman. They sent a plumber to her house to fix the leak in the basement that was causing the mold that was aggravating her asthma. That's a quality outcome. You follow the patient and you say, where does the problem exist? and how do we affect the change that is needed? And that's the same thing with preventative healthcare, is that where do we put our resources so that the impact that we have on those resources creates the best kind of a quality outcome. And I was really struck by something you said, Dr. Sterling. We don't have a healthcare system in this country. We have a healthcare industry. And I think that we have to approach this in a much different way. Healthcare, as we know, is so much more beyond just what a business is. This is our life. This is our soul. This is this is who we are. And so I think we have to design our healthcare systems again with the people in mind whose lives we want to affect that change. And that's what prevention is all about. Just a few comments. I don't know if that answers what you were looking for or not.